In terms of recovery, can someone fully recover or someone can be fully capable as an adult in society?
Well, I think we can look at it in a sense of when something bad happens to a person, a stress, how does one recover from it? Let's say, for example, something that might be applying to all of us. I didn't get accepted for a job. My husband left me. If you're a child, my parents broke up. So how does one recover from that? I think it's the same kind of idea. Some people have a little bit more resilience, and depending on the surroundings, they can recover a little bit more easily. And some people, it takes a lot longer because the wound is deeper. So it's the same thing when one talks about a psychotic illness. Some illnesses are a little less intense and recovery can be a little more easy. Others with very intense and very resistant symptoms, it can be very difficult. However, having said that, we try to put the accent as much as possible on recovery, saying to the person, look, we've gone as far as we can go with the symptom control. You still have a lot of symptoms. It would be important now to try as hard as you can just to do some things that you enjoy doing. Hence the accent on things like work programs and leisure activities that are meaningful for the person, and so on, so that the person again has a sense of returning to society. Again, this can be difficult because often people are living in poverty and don't have the same access to things that the average citizen has, like thinking twice before being able to go to a film, simply because going to a film nowadays is very expensive. So things like that, or buying a book, or buying a CD, or even having cable. Some things are so expensive that they're hard to imagine when one receives only social assistance. But the idea is the same. That is, one can be a citizen, and it's a question not just of the activities, but it's also a question of self-esteem and self-respect. You didn't ask for this illness. It's not your fault. It has no bearing. You shouldn't feel stigmatized because of this. It was bad luck. Just don't consider it as much as you can. As much as you can, just try and get it out of your mind that this is a stigma that is something that you've caused. It's nothing you've caused. Go proudly into the community and just face life with your head high. Essentially, we try and pass that message so that people will say, well, okay, so I have an illness, and I may even be obviously ill, with certain movement disorders or cognitive problems, but that doesn't matter. I'm still a person. And I think that we have to continue to encourage that approach by society at large, by caregivers, including clinicians, and of course by the patients and their own families, who have to see that, look, this was very bad luck, but it's not going to be the end of the world.